Good afternoon. Thank you. Thank you, guys. Thank you for connecting. I see a few people already joined, so we're just gonna allow a couple more minutes to get more people on the seminar, and we'll start after that. Just want to make sure that everybody's able to hear me. Okay, just give me a thumbs up.
We can hear you great.
Perfect. What's going up? Just a couple more minutes. One more minute. All right. So it's 1:03, guys. I think we're gonna start now. So thank you for connecting early. Hopefully, we get some more people to come and learn with us. I'm Dr. Fernandez, presenting to our monthly seminar series. So we are wrapping up February, but basically it's a new year, new option, new goals. Um, Basically, we want to focus on your health, right? So joint pain, and we want to kind of talk a little bit about the options beyond cortisone and surgery, what we have to offer. Talk a little bit about why regenerative medicine is changing musculoskeletal and conventional orthopedic care. Okay, so let's dive in. So the objectives for today. So we want to understand who QC Kinetix is. We want you to understand who QC Kinetix is. Understand where QC Kinetix fits in the continuum of care. So biologics versus surgery and cortisone. Explain how regenerative medicine targets underlying pathology and not just masking the symptoms. Review real patient experiences and outcomes, patients that walk every day in our doors, basically, and determine if you're a candidate and schedule a consultation. Finally, that's the goal here. So a little bit about myself. So Dr. Fernandez, been with QC Kinetix since 2021. I'm the regional medical director for South Florida, now expanding, growing. So we are opening our 12th clinic now. I've been very proud, and it's so rewarding to see all these patients that we have under care and their stories. So everybody's different, but it's been a very rewarding experience. So I'm a board certified family medicine with a focus on sports medicine and physical medicine and rehab. Um, Finished my training at East Carolina University some time ago. My wife is also a physician, so she was in the same program as I did. Graduated medical school from St. Matthew's University School of Medicine and completed my bachelor's and master's from Florida International University down in Miami, Florida. I dived in a little bit into some chemistry and toxicology, so I was really passionate about that as well. So that's a little bit about myself. So who QC Kinetix is? So basically, we are the largest regenerative medicine practice in the nation. So over 150 locations and counting. And we have treated over 45,000 patients, 46,000 to be more exact. So it's been an amazing journey, and seeing this amount of patients over the years and walking along their journey and seeing their progress, and in a lot of cases changing their life. So it's been amazing, really. So I want to show you one of those patients' experience, and basically she was treated in one of our clinics, and I want you to see her amazing results after she completed her treatments.
I started back in December with an injury that I had that was long-term. Did an exercise and couldn't move my arm. Couldn't even shake somebody's hand. I couldn't open a door. So I went to an orthopedic, pretty much told I have to live with it. Went to another orthopedic, pretty much told me that I'm not really a candidate for surgery, but I can take some prescription medications. And I've been hearing about QC Kinetix for quite a while on the radio, and I finally said, you know what? Let me go and see what it's all about. Here I am, 4 injections later. I feel amazing. I'm going to say 90% better.
That's amazing.
Right? Not cheap, but definitely worth the investment in myself, right? Because if we don't have our body and our health, I can't continue to go to the gym and be, active as I am. I do yoga, I do CrossFit, and I couldn't do it. I was depressed. And I thank you so much.
Wow.
I just recommend it to anybody that's going through the pain that I went
so
through.
glad to hear. It gives me goosebumps because I remember you when you came in, and I'm so glad you're doing so well.
And amazing, you've done amazing. Even though you come and you inflict pain that day with your injection, I'm going to tell you, the next 2-3 days after, I feel amazing. 4th injection, like I said, I feel incredible. So thank you so much. I really from the bottom of my heart.
So you would recommend our product?
I would definitely recommend.
Excellent. Thank you. Wow, that's amazing. It still gives me goosebumps, by the way. So every time I see her, she comes by and visits sometimes in the clinic. So I feel so rewarding to see how far she has come. And we see that. So across all of our clinics, we see a wide variety of patients, different stories, different goals. And because of that, our goal is to understand not only where you are in your pain or your journey, but where do you want to be? So that's why the first step in our evaluation consultation is so it's so important. So we want to clarify why you are seeking treatment. First of all, we want to set realistic expectations and timelines. So we want to go over the whole journey, so patients have that understanding and that transparency along the way. And of course, we want to make sure that these results are long-term success, long-term lasting, by creating that accountability, by creating that collaboration between you and the physicians and our providers. That's the way we're going to get there. So, but we do walk along the journey, and we're going to set you up with all the tools you need in order to succeed. So this is a big number, so a staggering number. So this is coming from a study that came in a couple of years ago, but mentions about the use of anti-inflammatory medications and aspirin. So 29 million people. I mean, that accounts for 12.1% of our population. Out of those, 65% have osteoarthritis. So at some point that they have been advised or recommended to take NSAIDs or non-steroidal anti-inflammatory medication. So it's a big number. So let's talk a little bit about standard of care. So basically, I'm sure you're familiar with this. I'm sure you have been across this cycle and you kind of recognize this. People, I mean, you have been through this. So basically, you have been to an orthopedic surgeon, to a primary care doctor with some aches and pain, and you mentioned that, and the first thing that comes out of the mouth, hey, listen, let's give you an NSAID to see if that takes away the inflammation and pain, and go your way. So, but we typically realize that that's not it might not help. Maybe just helps for a couple of days, couple of weeks, and then you come back, and then they up that dose on the NSAIDs, and there you go. You go on your way as well. So we know that that's not the answer. You continue lingering. They do an X-ray, right? And they notice, hey, yeah, you have arthritis. So there you have it. So let's offer you a couple of cortisone injections and see if that kind of helps you with the pain, the inflammation, and go your way. But we soon realize that a lot of these options are not great options. They're just basically a Band-Aid, just masking the symptoms and not addressing the underlying issue, which is the actual degeneration of the tendon, the joint, or an injury that you have suffered. So basically, you're going to go through that, and hopefully you don't have to get to that surgery pathway. I know a lot of patients have, and I'm so glad that we're doing this now in order to avoid that. So let's dive in. So basically, symptoms versus pathology. We just touched on it. So a lot of those options from standard of care or conventional medicine is basically just masking the symptoms up. So helping temporarily with the pain and inflammation, but the alarm is ringing, but the fire is still on. So basically that's a great analogy right there. Instead, what do we do at QC Kinetix? So regenerative medicine, right? So we go to the root cause of the issue, we target the pathology, the damage, and we're gonna address that from within in order to help long-term with the symptoms, with the pain, with the inflammation, and getting you to a better pathway. So comparing your options. So we just touched on it. Basically, cortisone injections is short-term relief, potential for long-term damage, and we're going to talk a little bit more about that. Basically, increasing your chances for more invasive surgeries, arthroscopic surgeries, as well as knee replacements. So they're not great options, and the profile, side effects are enormous. So a lot of patients are trying to avoid that. They know, but they don't know that they have another option. And then surgery, right? So once you do that, it's basically a structural altercation or alteration of the joint itself. If you ever have to get a joint replacement, you know there's no way back. And I want you to make it clear. So once you do that, once you go for a knee or a hip replacement, there's no place for regenerative medicine at that point. So it's very important for you to know that, to really think about it, to weigh all your options before you decide to do that. I mean, the risk is immense, the recovery, and there's no guarantees either that your pain is going to go away or you're going to be any better. And then there is us, biologics, regenerative medicine. So as I mentioned before, so it's natural healing, minimal downtime. We target the root cause of the issue, and little downtime, if at all. It's just a process, of course. Nothing happens overnight, but every patient is different. And I've seen stories, I mean, patients responding just a couple of days after the first session. So let's go back to that wheel, that standard of care, that conventional medicine. So cortisone injections. So let's talk a little bit more about that. So the hidden cost of conventional treatments, cortisone injections. So we already talked a little bit about it, and I mean, this is so important. I see patients walking on my door, walking in my clinic, and getting through the history, and they tell me, "Hey, doc, I'm getting these injections every 3 months. Sometimes they don't even last a week, but I keep getting them because that's what my doctor recommends." And I just think to myself, that's unbelievable. I mean, we have seen studies have come out. This is a great study, a great example of that. So just one cortisone injection is going to increase your chances by almost 10% to require a knee replacement. Imagine if you have been doing that for a year. So how much damage, how toxic it is to the joint, to your body itself. So there you have it. Next slide. And then the hidden cost of conventional treatments, of course, arthroscopic surgery. So we have seen patients over 50 years old who undergo a cleanup, which is an arthroscopic surgery, trimming the meniscus if you have suffered some meniscal injury. So that also is going to increase their likelihood of eventually needing a knee arthroplasty or a knee replacement within a decade, so 10 years only. So imagine if that has to happen, the first injury happened in your 40s or in your 50s, so you are really at a higher risk of needing a knee replacement, not to say that you have better options. So why patients choose regenerative medicine? So understanding the benefits. So we just briefly touched on it. So basically, we treat the root cause of the pain. So we go to the underlying pathology. So we don't want to just focus on pain and masking the symptoms. We want to go to the root cause of the issue. So minimally invasive, low downtime. So yes, basically patients can continue their own normal lives. Of course, we're going to give them instructions so they know exactly what to look for. And these are minimally invasive. So patients are able to tolerate these procedures, injections, basically, and they can just continue their activities as normal. We work with your own body's arsenal. So we don't use any other drugs, steroids, or NSAIDs. So we want to make sure that we get in the whole capability of your body to regenerate, to repair, to restore the function to that joint itself. And then finally, bottom line, and I would say like 70% of our patients are trying to avoid surgery somehow. So that's the bottom line. So at the very least, we want to delay that process as much as possible. But I see it in my clinic. Most times we are able to avoid that process altogether. And that's what we want. So let's talk a little bit about your body's natural healing toolkit. And this is exactly what we do in our clinics. So let's talk a little bit about platelet-rich plasma, or PRP. What is it? So basically, the main function is reducing inflammation, getting to that signaling, that growth, by using different cells, cytokines, growth factors. They're going to start the process of repairing and regeneration. Then comes A2M, alpha-2 microglobulin. This is a very potent protease inhibitor protein that lives in our own bodies. We call it the chill because basically it's going to stop it's going to block some of these proteins that have to do with a lot of degeneration in the joint. But at the same time, they have a lot of other proteins and growth factors that would also help in the regeneration and the remodeling process as well. And then let's finish with bone marrow concentrate, right? So these are your own autologous stem cells. So deep tissue repair, great potential for regeneration, and it's what basically is going to lead to that actual regeneration. So these are your own stem cells, rich on it, and I'm so glad that we're doing this. So again, let's go back to that cycle, right? So you saw a little bit before conventional standard of care, the options that you previously had, including the NSAIDs, cortisone injections, and God forbid that you have to go for a knee or a joint replacement. So instead, we want to restore that homeostasis to the joint, so that repair, that regeneration, by using your own toolkits, stem cells, growth factors, platelets, proteins. We're going to achieve that stability in the joint, that healthy new tissue, in order to having you do more and live a better life. So let's talk about the processes here. So yes, what should you expect when you go to any of our clinics? So you should expect a very focused and comprehensive orthopedic exam. So most of the cases also we use, I would say all of the cases, we have tools in the clinic like the ultrasound in order to take a look at the structural joint, the structure of the joint, and really have more of a precise idea on the diagnosis that we're looking for. So basically, after you decide to start treatment, I would say 90% of our patients start treatment the same day. As I mentioned, time is tissue, so the longer you wait, the worse your condition could get. So we don't want to waste any time. So you should expect drawing your blood. Then we're going to take it to our lab. We're going to go through the process, the preparation, and then we're going to come back into the room. And while using the ultrasound, we want to make sure that we are precise in our approach. So this is a precision medicine field. So as such, all of our injections are conducted under ultrasound guided. And then patients are able to tolerate those very well. And then we're going to work with you in terms of the post-procedure guidance, the follow-ups, giving you all the tools. We want to get you moving. So motion is lotion to the joint. So we want that as well. So that's what you should expect in a normal process. So, okay. So basically, this is basically my content. So I'm so glad we're doing this on a monthly basis to create that education and making sure that we answer all the questions we can. So I mean, if you're ready to take your life back and get back on take charge of that, this is a great opportunity for you to take care of that and book that appointment today. So you have a special offer if you mention our webinar, so you could get a free laser with your consultation. There is a phone number and a QR code, so you could book that right away. We're waiting for you. So I know this has been we've been doing a lot of campaigns by getting to more that educational side, and patients appreciate that because a lot of times they don't even know that this option exists. So we want to make that more aware and bringing the awareness to all the population out there. I'm sure you're going to have more questions. Feel free to text some of those questions on the chat, and we'll be able to get back to you on an individual basis. But thank you for joining. Thank you for the time. Looking forward to do some more of this. Have a good day.